prevent the risk of spreading the illness. And you just stay at home if you feel sick, even if your symptoms are mild, but once they get exaggerated, that's the time that you only go to the hospital. Always remember to not go to work, to school, or public places if you have contracted or if you tested positive for COVID-19. And you always remember that symptoms of COVID-19 are treated for fever, and we only prevent dehydration and body aches, and there are over-the-counter medications that may be taken to help you recover from your mild symptoms. But the best bet that you can do while you're isolating and while you're recovering from COVID-19 is to strengthen your immunity. And how do we do that? We take micronutrients such as vitamin D from sunlight, vitamin C from citrus fruits and vegetables, and zinc, because these are critical for a well-functioning immune system, and they also play a vital role in promoting health and nutritional well-being of individuals. Now, for example, you're severe, or if you feel like needing medical care, you have to call before going to the doctor's office and tell them that you have contracted COVID-19 and that you have tested positive for COVID-19, so that they can also take proper measures or protocol to protect themselves. Now, call your healthcare provider if you develop high fever, respiratory distress, or other severe symptoms. And you have to describe your symptoms over the phone before going to the doctor's office. But if your cases are mild and you think that it can be managed at home, just stay home, do a little exercise, take a lot of rest, and eat nutritious fruits and vegetables. That is how we recover from the COVID-19 infection if ever you contract the disease. Now, another thing that we can do to further protect ourselves from contracting the infection or from preventing ourselves from developing severe symptoms of COVID-19 is to get vaccinated. Sobrang laking tulong po ng pagbabakuna against COVID-19. And remember that vaccines are our friends in this time of pandemic, kaya hindi dapat sila kinatatakutan. Now, remember that your vaccines will lower the chance of you contracting the disease or getting COVID-19. But it doesn't necessarily mean that you will not be exposed or you will not be infected with COVID-19 already. There is still a slim chance that you will get COVID-19 infected. However, in the event that you get COVID-19, your symptoms will be prevented from becoming severe. So dun po pumapasok yung importance ng ating COVID-19 vaccines. Always remember that it is our responsibility to protect each other during this pandemic, and our vaccines is one way for us to achieve herd immunity. At anong ibig sabihin nun? Pag lahat tayo ay bakunado na, all of us in the community get immunized against COVID-19, then hindi na po masyadong madali for the virus to penetrate our community. And that is how we protect each other, by getting ourselves vaccinated for us to easily achieve herd immunity. Now, marami pong mga brands ang mga vaccines natin ngayon. Yung mga iba, hinihintay yung Pfizer, may mga iba, mas gusto yung ganito, ayaw sa ganitong bakuna. Yung mga iba din nagtatanong, ano ba yung pinakamagandang vaccine? Ang sagot lang natin dyan is that the best vaccine is the one available. You have to remember na mas maganda po na kahit anong brand ay kunin ninyo, as long as you have protection against COVID-19, that's better than having none at all. Okay? So it is better to have 66 protection than no protection at all. Ibagbagay yung AstraZeneca, mababa po yung kanyang protection rate na naibibigay, but 66 is always better than 0. So you have to remember that the best vaccine is the one available. So my advice to you is you get yourselves vaccinated, you go for screening, ask your rural health officers or municipal health officers about it, have yourselves screened and receive the vaccine as long as it is available in your community. That is one way to protect not just yourself but also the people around you. Now let us zero in on the 3 precautionary methods that I have discussed a while ago. The first precautionary measure is what we call hand hygiene or tamang paghuhugas ng kamay. And this is the most effective and the most cost-efficient preventive measure to break the chain of infection. Lagi niyong tatandaan na yung virus, bago tayo ma-infect, ay kailangan munang makapasok sa ating katawan. And before that even happens, dapat ay break na natin yung chain of infection by washing our hands regularly. Always remember that washing your hands with soap and water for 20 seconds is one of the best ways to stop or kill these viruses and bacteria from entering our system. Now, kung ayaw nyo namang gumamit ng timer, ayaw nyo gumamit ng 20 seconds na yon, you can just sing happy birthday, the whole happy birthday song while washing your hand. Any type of soap can dissolve the fat membranes of the virus, making it collapse. So regardless of the brand of the soap that you are using, as long as you are using soap to wash your hands, that is enough to kill the virus. Now, if you do not have access to a faucet or soap or water, we can just use alcohol. But as much as possible, we use 70% isopropyl alcohol. And we only use this alcohol if our hands are visibly clean and there are no debris or walang mga dumi-dumi. Kasi pag may dumi-dumi po dito, it is always best to use soap and water if our hands are visibly dirty. We can only use alcohol if there are no debris that are found in our hands. Now, as a general rule of thumb, we must always remember to wash our hands before any of these things, as washing our hands and keeping them germ-free can prevent the spread of infection and contamination. Mapa-COVID-19 pa yan or any other diseases. So when do we perform hand hygiene? We always have to perform hand hygiene or hand washing before preparing our foods, before eating, or before caring for someone at home who is sick, before treating a cut or treating a wound, we always have to wash our hands, and before breastfeeding. So those are the times that we need to wash our hands before doing the procedure. Now, there are also guidelines when it comes to hand hygiene after the performance of some task. Kung kanina po, before the performance of a task, dito naman, we need to perform hand washing after the performance of a specific task. To prevent the spreading of whatever microorganism that has lodged on your hands after doing that task, remember to wash your hands thoroughly with either soap and water or 70% isopropyl alcohol. The activities that will require immediate hand washing are the following. Number one is handling of food products, especially raw meat, fish, and poultry. After handling these raw meat products, you have to wash your hands to prevent the spread of the microorganisms that might be lodged in our hands after handling those specific raw meat products. Aside from that, you have to wash your hands after changing diapers or assisting someone who has just used the toilet. Also, remember to wash your hands after using the toilet or after blowing your nose, after coughing, or after sneezing. You also have to wash your hands after treating a cut or a wound, and wash your hands after visiting a public place like the marketplace, the pharmacy, or grocery, because you don't know who might be harboring a specific contagious disease, and you might be able to contract these diseases if you don't wash your hands after visiting those public places mentioned. Aside from that, you have to wash your hands when you are returning home or coming back indoors, and wash your hands also after touching animals, because they might also be harboring or carrying certain types of viruses or bacteria. Also, wash your hands after handling garbage or trash, after handling money, and after contact with any bodily fluid or samples, especially if you are in the hospital. So those are the guidelines for washing your hands after a specific task. We will be watching a short video from the Department of Health, World Health Organization, UNICEF, and USAID to learn about the proper way to do hand washing with soap and water. I know that some of you are saying, we already know that. Alam na namin kung paano maghugas ng kamay. But remember that no matter how basic and no-brainer this video might seem for you, it is important that you always follow these steps in hand washing, especially if you will have your duty in the hospital. You need to learn how to protect yourself and your clients by doing proper hand washing before, after, and in between handling of patients. So, watch closely, okay? We will now play the video.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
Again, what you saw is a video on proper hand washing from the Department of Health, World Health Organization, UNICEF, and USAID. I hope that you practice these steps in your own houses and make it a habit so that you won't have a hard time doing the proper hand washing when you are already in the hospital.
This time, let's watch the proper way to do hand hygiene with 70% alcohol. Let's do the hand rub together with a video.
Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
Now that we know how to properly wash our hands with soap and water, we will again be watching a short video from the Department of Health, World Health Organization, UNICEF, and USAID to know the different steps in applying alcohol-based hand rubs. Watch closely. Now that you know how to properly use and apply alcohol-based products to clean and disinfect your hands, we're expecting you to put to practice these new skills. Also, do try and share these steps and techniques with your friends and loved ones so that they too can better protect themselves against infection by washing or disinfecting their hands with alcohol-based formulation. When you go for your duty in the hospital or any healthcare facility, remember that there are 5 key timings to do hand washing. Number 1 is you have to do hand washing before handling or touching any of the patients. Number 2, do hand washing before performing any clean or aseptic procedure. Number 3, do hand washing after exposure to any bodily fluids from the patient, such as blood, urine, and nasopharyngeal secretions. Number 4, do hand washing after touching the patient. And number 5, do hand hygiene after touching the patient's surroundings, because you don't know if the surfaces you are touching are clean or not. So it's always best to be safe than sorry. Now, in the event that we run out of soap or there is no alcohol-based hand rub nearby, we can use chlorinated water of 0.05% for hand washing and disinfecting. So we can just use a pail of water and just a few tablespoons of chlorine, or what we call Clorox in our own dialect, and that can be used for disinfection. However, that is only a last resort or a last option. Now, if you go to the hospitals or healthcare units or facilities in Ilocos Sur, there will be hand hygiene facilities around the vicinity. Marami pong mga pwede tayong paghugasan ng kamay or mga alcohol dispensers doon, but it is always best if you bring your own alcohol and soap with you when you go for duty or if you go out of your own home, so that if there are no facilities nearby for hand hygiene, at least you have your alcohol-based products with you to wash and disinfect your hands. Another way to prevent the spread of COVID-19 is by maintaining social distancing. The term social distancing is also referred to as physical distancing, and both of them mean the same thing. Pareho lang po ang ibig sabihin ng social distancing and physical distancing. But right now, the DOH is gearing towards using the term physical distancing so as not to confuse the general public of social distancing from social isolation, kasi magkaiba na po yung social distancing and social isolation. So right now, the term that we are referring when we want to distance ourselves from other people within the certain meter or suggested na distance is what we call physical distancing. Now, physical distancing means that you have to limit your physical contact with other people because they might be harboring the virus. So, paano ba natin gagawin ang social distancing or physical distancing? Hindi dapat tayo nagtutungo sa mga masisikip na lugar at di mahahalagang pagtitipon. So, if the occasion that you are attending is not that important, then consider not attending that occasion anymore. Ano pa? Hindi dapat tayo nagtutungo sa mga karaniwang, hindi natin ginagawa ang mga karaniwang pagbate tulad ng pakikipagkamay or doing handshakes, beso-beso at pakikipagyakap or hugs. As much as possible, we avoid doing those things to prevent the spread of the infection from one infected contact to the other. And hindi dapat tayo nakikipag-ugnayan sa mga taong mas delikadong mahawaan ng virus tulad ng mga matatanda at may mga mahihinang resistensya. So as much as possible, we stay away from people who are vulnerable, those with comorbidities, if you will, yung mga matatanda, sobrang bata, those people who are immunocompromised. We should not be maintaining contact with them, close contact with them, because we don't know if we are harboring or we are carriers of the virus or not. When we are doing physical distancing, we keep more than 1 to 2 meters distance away from each other. So isang dipa dapat yung layo natin from one person to the next. Also, we avoid close contacts, including kissing and shaking of hands, like I said a while ago. And if we feel unwell, it's better that we stay home. And also, we have to always wear a mask when we go out to queue, or kung pipila tayo, or when we are going to be meeting with people, it's always best to combine our physical distancing with wearing a mask. That is how we prevent the spread of the virus from the other. So marahil tinatanong nyo, sir, bakit ganito naman 1 to 2 meters apart? You have to remember that droplet infection kasi, or droplet na measure kasi, kaya nagtatransfer yung virus from one person to the other. Now yung droplet kasi na ito, because of gravity, babagsak na yung mga yan in 1 to 2 meters of distance. Kaya okay lang na panatilihin natin yung isang dipa, because those droplets will not anymore reach us if we maintain that safe distance from one person. While we are in the subject of maintaining physical distancing, ang tanong ko ngayon is yung mga nakikita nyo bang people dito, the staff, the undersecretary of the Department of Health, are they on their physical distancing? Ang tamang sagot po dyan is yes. That is almost 1 to 2 meters of distance from one person to the other. However, we can still improve the prevention of the spread of infection by not just maintaining or observing physical distancing, but also by wearing a mask. So mas maganda yung protection nila from COVID-19 if, aside from they are spaced 1 to 2 meters apart from each other, dapat sila din ay naka-face mask as much as possible. Another precautionary measure that we can observe to prevent the spread of COVID-19 is by following respiratory hygiene protocols for coughing individuals. Always remember that it is always best to cover your mouth and nose using your elbow or using a tissue if you are coughing or if you are sneezing. Hindi po dapat kamay ang ginagamit natin na pang-cover ng ating mouth and nose when we cough or when we sneeze, because if we do so, those microorganisms causing COVID-19 will be lodged in our hands, and all the surfaces that we will be touching will already be contaminated. So instead of covering your mouth and nose using your hands when you are coughing or sneezing, hindi po dapat ganito. Gumamit po tayo ng tissue, or kung wala po tayong tissue, at least gumamit man lamang tayo ng ating siko to cover our cough or our sneeze. Now, in the event na gumamit po tayo ng tissue to cover our mouth and nose while we cough or while we sneeze, always remember to throw this in the proper receptacle. Itapon ang ginamit na tissue sa basurahan so that it will not be blown away by the wind, para hindi itong tissue na to ang magkalat ng virus na yon. Aside from that, ugaliin ang maghugas ng kamay pagkatapos umubo or bumahin, or always perform hand hygiene after coughing and sneezing, especially if you used your hands to cover your mouth and nose, or even if you use tissue, it is always best to wash your hands. Aside from that, it is also our duty to educate health workers, our patients, and families to observe respiratory hygiene for coughing and sneezing. Dapat po ay pinapaalalahanan lahat natin ang mga tao sa ating komunidad regarding the observance of respiratory hygiene, or tell them to cover their mouth and nose when they are coughing or sneezing to prevent the spread of these droplet infections. Aside from that, sabihin din natin that they should do hand hygiene after contact with respiratory secretions, and also always wear medical mask if you have respiratory symptoms if you are going out. And also, we tell people to avoid touching their eyes, their nose, and mouth, because these are the portals of entry of the COVID-19 virus and other microorganisms. So yun po dapat ang pakakatandaan natin when we are observing respiratory hygiene for coughing and sneezing people. Now that we have already understood what COVID-19 is and the different precautionary measures to prevent the infection, let us now learn the proper usage of the different personal protective equipment that we can employ to prevent the spread of the virus and to protect ourselves and our loved ones better against the virus. Again, all of the information that I will be sharing to you on this module are from the Department of Health, the World Health Organization, UNICEF, and USAID. The next topic is the use of PPE, or what we call the personal protective equipment. And on your screen are examples of PPEs that we can use to prevent the spread of COVID-19. The medical mask and the N95 mask that you are already familiar with will cover your nose and mouth, and that will prevent the entry of the virus through your respiratory system. The goggles and the face shield will cover the eyes, and the face shield can also cover both mouth and nose along with the eyes. However, when we speak of the gowns and the aprons, they protect the body, while the heavy-duty rubber gloves and latex gloves protect the hands when we are doing procedures, especially that has something to do with contact with patients with COVID-19. And the rubber boots will also protect our feet. Now, for personal protective equipment to be effective, we should follow a list of guidelines. At ano yung mga guidelines na yon when we are using PPE? We have to remember that we should put on this PPE before contact with a patient. So bago pa lang tayo mag-handle ng patient, dapat naka-PPE na tayo accordingly. We have to also remove immediately this PPE after completing the task and then discard them in appropriate waste containers. Do not just leave your PPE lying around freely, because when you leave it in areas, they might be contaminating the surface of your workplace or the hospital. Also, clean and disinfect regularly those reusable PPEs in between use. So dapat nililinis po natin yung mga reusable na PPE natin, and we should change immediately those PPE if it gets contaminated or if it gets damaged. Mas maganda po na palitan na lang natin at wag na nating gamitin yung mga damaged PPE, because if we just keep reusing these PPEs even if they are damaged, kasi sasabihin mo sayang naman pag itatapon, that damaged PPE will not be protecting you any longer. Aside from that, your PPEs should not be adjusted or touched during patient care. Bakit hindi mo na dapat ina-adjust siya during patient care? Because you might break the integrity of the protection. Baka kaka-adjust mo ay napasukan ng virus yung inyong mask or inyong gowns when you are adjusting it during patient care. Aside from that, you have to remove this PPE carefully to avoid contamination. Protected ka nga before and during your patient care, pero nung tinanggal mo, hindi mo properly siya tinanggal, tendency gowns when you are adjusting it during patient care. Aside from that, you have to remove this PPE carefully to avoid contamination. Protected ka nga before and during your patient care, pero nung tinanggal mo, hindi mo properly siya tinanggal, tendency is mapapasukan ka pa rin ng COVID-19 virus. So you have to remove this PPE carefully to avoid being contaminated. Our next discussion are the 3 patterns for minimum required PPE. Always remember po that there are scarcity of personal protective equipment in our country right now, and hindi dahil sa nagjo-duty tayo sa hospital ay lahat tayo dapat naka-full PPE na din. Hindi po ganun yon. There are required minimum PPE na gagamitin natin depending po sa roles and functions na gagawin natin. Now, the medical mask on the leftmost figure, dito po sa nakikita natin na naka-medical mask lang, is the minimum required PPE for those who will just conduct interviews that are less than 1 meter distance, or those who will drive a patient from one healthcare facility to the next, or those who will stay at the triage area and are less than 1 meter away from individuals who may be COVID-19 positive. So kung ikaw ay mag-i-interview or magdadrive ng patient or nasa triage area, hindi mo kailangan ng full PPE. Ang minimum required lang na gagamitin mo is medical mask at that is enough already to protect you. However, if you are providing direct patient care to patients who are suspected or probable or confirmed COVID cases, but these COVID cases or procedure na gagawin mo will not be generating aerosol naman or what we call AGP. Okay? Those procedures that you are doing will not elicit the spraying or droplet coming from the nose of or the mouth. Example, hindi ka naman mag-intubate, hindi ka naman mag-extubate, or hindi ka naman magte-tracheostomy, or hindi ka naman mag-upper GI or ENT endoscopy, or hindi ka naman gagamit ng ventilation. Okay na po ang medical mask, goggles, or face shield, gowns, and gloves. Remember, if you are giving direct care to patients with suspected, probable, or confirmed COVID cases, pero yung mga procedure na gagawin mo ay hindi naman mag-generate ng aerosol or without AGP ang tawag natin. Sa mga procedure na to, kunwari, magko-collect ka lang ng samples or kunwari, you're a lab technician who will just extract blood, who will transfuse blood, or kunwari you're just a cleaning staff or laundry staff ka, or you're just there to collect the dead body of those patients. Wala namang aerosol kasi na manggagaling sa patient when you do those procedures. Therefore, okay na po ang gumamit ng medical mask, ng goggles or face shield, gowns, and